So, Dr. Smith, what kind of symptoms should people be looking for during the acute stages of Lyme disease?
Well, the very important signature symptom of early Lyme disease is the Lyme rash or erythema migrans rash, which usually comes on a few days to a week or so after the tick has fed and left. The rash in the textbooks looks like a bullseye, and you often see that represented as a bullseye with rings. But in fact, when you see the rash early on, it's often a single red circle, flat, not particularly itchy, not painful, maybe a few inches across, and it may grow with time over a few days if you're not sure what it is. And it can be variable. Sometimes it can be a band-like rash if it's behind a knee, or it may be more circular if it's on the thigh. It's often on the lower extremity in adults or the back. In kids, it may be higher up. This rash is really helpful and is present in about 80% of people in the good studies where it's been looked for who have early Lyme disease. So that's a first pointer that people can if they find that, take a picture of it and send it to their physician. That can be the diagnosis right there. About 2/3 of the time, other symptoms are present, and they may be noted before the rash just because the rash hasn't been seen. And these are pain that moves from one joint to another, headache, neck stiffness, just a general feeling of absolute fatigue, not wanting to do much of anything. It can be a pretty miserable experience. Some people don't have any of those symptoms, just only have the rash. And then about 10% of the time in the studies that have looked at this, people may have multiple rashes. So there's more than one circular rash. They may have 10 or 15 different circles, all a few inches in diameter on their body. I've noticed sometimes physicians don't recognize that this can also be a presentation of Lyme disease. If the rash is not recognized as such and people go on to have continued symptoms, first of all, the rash may go away, but they will, in a small minority of cases, develop other complications. And maybe 10% of the time or so, they might get a neurologic nerve-related complication. In early Lyme disease, maybe 3 to 4 weeks out, this might involve facial paralysis, which can occur earlier as well, or a kind of meningitis. It's like a viral meningitis, so persistent headache. And then very rarely they can develop a heart condition, a heart block condition that can cause dizziness and fainting, and even can be serious enough to require temporary pacemaker.
Thank you. So, Dr. Kalish, if those early signs are missed and Lyme disease progresses, what are the late stage symptoms that people should be looking for?
Right. So, yeah, I'd like to talk about the Lyme arthritis in particular that can happen late. Just before that, I just want to pick up on what Dr. Smith mentioned about the joint pain migrating around early. That is really typical of early Lyme disease, is sometimes pretty intense pain in a joint. It will migrate one day to the next to different joints, and that's what you're looking for in sort of the pattern of joint pain in early Lyme disease. In late Lyme disease, and this can be months after the tick bite, in fact, it typically is about 6 months after the infection that maybe wasn't recognized in the summer. So it could be December, January, as actually would be a typical time when people aren't thinking about Lyme or ticks as much. And typically what someone will get is one big joint, usually the knee, swelling up and becoming painful and swollen just out of the blue. Occasionally it's more than that. It might be both knees. They may even take turns swelling. That would be typical of Lyme even without treatment. It could be occasionally an ankle or a hip. And in kids, actually, hips are more common. But that's what you expect. So Lyme arthritis presents that way. If you check Lyme titers at that time, they're actually through the ceiling. It's about the highest titers we see. So luckily, it's actually can be easy to diagnose at that point if the physician thinks about that. So again, I'd like to emphasize that that's what, and luckily can be treated then in the majority of cases successfully with antibiotics. I think what I'd emphasize as a rheumatologist is that Lyme disease doesn't just give a general long-term aching of all the joints or the back or anything like that. That would probably be more common arthritis. Lyme arthritis is really one or two big joints that get swollen. So that's what I counsel people to be on the lookout for in terms of late Lyme disease. Finally, very rarely there's been described neurologic Lyme disease that's late if it wasn't caught early, either affecting the peripheral nerves, affecting sensation, tingling, numbness, a little loss of sensation in a hand or a foot, or occasionally in cognition and thinking. But I do want to emphasize that's thought to be very rare. And by far, someone who has symptoms of tingling in a hand or a foot, or even feeling like their memory's not working as well, it's going to be from other things besides Lyme. That's exceedingly rare. So those are the important pointers about late Lyme disease.
Great. Thank you both so much.